Hey, why don't we now conduct a postural screening? Postural screenings are a really important part of our initial consultation. Now, to do a great postural screening, make sure you've got a nice space, a well-lit room, so you can see your client, and make sure also you've got some way of keeping security within your room. Your client will feel very vulnerable being in front of you, and you don't want to have people barging in and out. So have a private room, have a system where on the door you can maybe have fitness assessment in progress, and advise your client early in the piece that when they see you for their initial assessment, you will be doing a postural screen. So some shorts, maybe a crop top, something so you can see some posture without your client feeling, a little bit difficult or vulnerable with things. Now, ideally in the room, you'd position yourself 2 to 3 metres away from your client. That way you get a good long view at them. You look at 3 positions. We're looking at anterior, lateral, and posterior views. They are our 3 views. The order is posterior, lateral, and then anterior when you're actually taking these. Both the anterior and the posterior views give you symmetry from one side to the other. They also give you levels, such as the knee line and the pelvis line, and the level of the shoulders and the scapula. The lateral view gives you a big information on your spinal curves and your pelvic orientation. So we get some really good information there as well. At the very end of your screening, very importantly, debrief with your client. Let them know what you saw, present it to them in a nice professional way, realising that we, as postural assessors, don't diagnose our clients. We're just looking at things that will influence exercise. So the screening tool that you use, it'll take you about 3 minutes maybe to work through your postural screening, 3 to 4 minutes. You simply mark off the obvious things and then debrief with your client what you're going to do during exercise to help address those. And that way you'll have a nice postural assessment that has meaning to your client and assists you with your programming.